Hello and welcome to the program. I am DEJI360 and you're watching DEJI360. Today on the program we're talking about something that is very, very disturbing. We're not looking at politics today, but we're looking at the issue of health. Now, Nigeria is somewhat in a state of panic over the disturbing news that the dreaded Ebola virus may have found its way into the country. The Lagos state government in southwest Nigeria says it is investigating a case of suspected Ebola infection in the state. It's actually the first case ever. Health ministry officials in the state say the man with the suspected case comes from Liberia and was visiting the country before he came down with symptoms of the virus. And by the way, Liberia is one of the countries worst affected by the virus at the moment. Quite a number of people have died from Ebola infections there. Now take a listen to how Special Advisor to the Lagos State Governor on Health explained the situation.
2 days ago, that is Tuesday, July 22nd, the Lagos State Ministry of Health received information concerning a suspected case of Ebola virus disease from a private health facility. Details of the suspected case were obtained from the health facility, and this includes that he is a 40-year-old Liberian working for a West African organization in Monrovia, Liberia, who arrived in Lagos on a flight from Monrovia via Lome on Sunday, July 20th at about 4 p.m. History taken revealed that he had no contact with any case of Ebola virus disease. He did not visit any persons with Ebola virus disease in any hospital, and neither did he partake in the burial of any persons who might have died of Ebola virus disease. However, on account of his living and working in an endemic region of Ebola virus disease, which is Liberia, and the presentation of the non-specific constitutional symptoms and signs of the disease, which include fever, malaise, body aches, vomiting, diarrhea, etc., that are associated with the disease, a high index of suspicion was raised. And based on this, the patient was admitted and detained on suspicion of possible Ebola virus infection, while blood samples were collected for testing. And this was initiated with samples sent to the Virology Reference Laboratory at Lagos University Teaching Hospital in Idiaraba. Blood samples were also sent to a World Health Organization reference laboratory in Dakar, Senegal, which is actively in process, and the results are still pending.
The government is asking people not to panic, saying it has put all the necessary facilities in place to check the virus. Take a listen again to the Special Advisor.
Contact tracing has started. Lagos Mainland Hospital has been identified. We have cordoned off. We have created isolation units there. We have deployed doctors there. Our doctors, the Federal Ministry has assisted by giving us the personal protective equipment. They brought 30, and they're bringing 20 more, and 250 more, and we're procuring other gadgets to secure anybody that's going to be in contact with this patient or any suspicious case that comes thereafter. We have mobilized the Health Facility Monitoring Agency to get in touch with the private sector, which is their purview, to do some rapid sensitization. We're giving out IEC materials, informative, educative, communicative materials to the private sectors through HEFAMA. We're sensitizing because they're the first point of call. A lot of people will found that may end up going to the private sector, as is the case here. Our own staff, our facilities have been on standby since March of this year when the first scare came on. So we have been ready. We have had all kinds of measures put in place. So we're now focusing on the private sector to make sure that they have the same resources as we do to curb this and keep it under control or from spreading.
Now, among those at risk of contracting the virus, ironically, are those who treat it, doctors and medical workers. In Sierra Leone, a prominent doctor fighting the deadly tropical Ebola virus has himself caught the disease. 39-year-old Sheikh Umar Khan, hailed as a national hero by the Health Ministry, was leading the fight to control an outbreak that has killed 206 people in that West African nation. The doctor is now being treated, and we understand he is recovering very well. Joining me now to shed more light on this deadly virus is Dr. Omojowolo Olubumi, who is a senior registrar neurology and is also the president of the LUTS chapter, that's the Lagos State University chapter of the Association of Resident Doctors. Thank you very much, Dr. Olubumi, for coming on the program.
Thank you, sir.
Tell me, should we be worried with this latest development, this discovery in Lagos, even though it's actually not been confirmed yet that this is Ebola?
Okay, thank you very much for having me. We should not be worried, but we should take precautions. Worrying or panic can also be detrimental to containing the disease. Preliminary investigation or preliminary tests based on the samples collected from the Liberian patient actually confirms the Ebola virus. What we should be focusing on is prevention of the spread of the disease.
I have to ask you one very important question now. We heard the special advisor to the Lagos State Governor on Health saying they've started contact tracing. I mean, this individual flew into the country, was on board a plane, would probably have made contacts with some people. Does it mean what is required now is to try to do a contact tracing, trace the number of people that this individual has come in contact with to be sure that they are safe?
Yes, it is very important to actually trace the contacts, because one of the ways by which the deadly disease is transmitted through close contact with individuals that are infected with the disease. So those who have been in contact with this patient need to be traced so that they can be monitored and see whether they develop the signs or not. This disease can be transmitted through contact with bodily fluids. Different kind of bodily fluids,
like sweat, for
like
instance.
Sweat, like blood, like semen, different kind of tears, even tears. So this is a virus that can replicate in virtually all the cells in the body. So close contact has been known to be one of the mode of transmission from man to man.
How difficult do you think it will be to do this contact tracing now, to trace all the people that this individual has come in contact with? For instance, he landed at the airport. We don't know the number of people he must have, maybe shook hands with. We don't know the number of, it just would be difficult, wouldn't it?
Yes, it's going to be difficult, but it's still possible to trace most of the people that he has been in contact with. It's not just that he's walking through a street. It's when you are in close contact with him, not that he just walks through and everybody becomes infected. It's not like that. People that have been in close proximity or contact with him, maybe possibly people that sat together with him, or even those who maybe he has gone to a restaurant or something, people that they are in close proximity, his friends and some close associates. So those are the people that we need to put eyes on them so that we monitor them and see whether they actually come down with this disease or not. Because to contain this disease, you have to really nip it in the bud.
One of the issues, you're a medical doctor and you work for an institution that is regarded as, it's a frontline health institution in this country, LUTS. Do we have facilities in our medical institutions, especially like institutions like yours, to deal with this disease, Of course, we're talking about a virus that has no vaccine, there's no cure, and do we have the facilities to deal with this?
Well, that is something that we need to look into very carefully, critically. Actually, to prevent the spread of this infection, we need some basic things like observing universal precaution. So that means that when, as a healthcare provider, a doctor, a nurse, or whoever is coming in contact with sick patient, you must observe some basic precaution, which is the first line of defense. Now, there are some specialized equipment, personal protective devices, which the commission, the Lagos State government were talking about in the interview. Yeah. And those are the kind of equipment that should be available in all these our centers. Because you see, the dangerous thing about Ebola fever infection, Ebola virus infection, is that at the early phase, it doesn't have specific symptoms. You don't know that
you could have a case of misdiagnosed.
Exactly. You don't know what is wrong with the patient. You can just think that the patient has ordinary malaria. So, and before you know it, the person that is taking care of the patient is already infected. So there must be high index of suspicion, and the history that you take from the patient is very vital, because number one, you have to establish whether the patient is coming from an endemic region, just like this man. You have to establish whether the occupation of the patient, whether the patient is an hunter or somebody that is involved in bushmeat and all those things, whether this is somebody that buries dead people.
Because it's contracted through bushmeat.
Yes,
eating of bushmeat.
Yes, it can be transmitted from animal to man through eating of bushmeat, and
even when this bushmeat is cooked, no matter what,
whether dead or alive, those bushmeats carry the virus and they can infect humans. So you have to take the proper history. So your suspicion must be very high. So once you have that suspicion, the individual must be isolated and quarantined, so that protection and all the necessary precautions will be taken in order to take care of such an individual. The unfortunate thing about Ebola virus infection is a disease that is very fatal. And you see, there are different species of the virus. The most virulent or the most fatal one is the one that is Zaire type, Democratic Republic of Congo. And almost 9 out of every 10 people will eventually succumb to the disease. So it's something that we really have to take proper precaution, and it is important that public education is vital.
Now, public education is very vital, and unfortunately it appears that is where we're not doing enough, because you don't see TV jingles, you don't see public enlightenment campaign out there educating people on this disease. Tell us exactly, how could one avoid contracting this?
Okay, thank you very much. You see, it's important for us to first know how once you know how it is transmitted, then you may be able to avoid it. Now, number one is that, as I've said earlier, one of the mode of transmission is through animal to man. So, especially those what we call bushmeat in Africa. So things like chimpanzee, antelopes, monkeys. So those are, whether dead or alive, once you get in contact with those animals, you are likely going to get infection. Now, for those who already have infection, another mode of transmission is through man to man, person to person. So if you are taking care of somebody that is sick, you are at risk, both at home and whether in the hospital. And you see, there are some cultural things that we do that also promote infection, like issue of burying our dead, the way we bury dead people. You see, because a dead person, a human being that is dead, that has the virus, is also infective. And that is one of the danger of this disease. So once we know the modes of transmission, what we need to do is just avoid doing those practices. And important thing is, individually, you have to actually have personal hygiene. So you must wash your hand regularly, you see, and just avoid just unnecessary, just be checking, especially if you are suspecting that the person, because one of the things that once the individual is infected, usually it comes down with high fever.
And it's possible that doctors could misdiagnose that for malaria or typhoid and all of that.
That is what I'm saying. That is where the danger is. Most of the time, the misdiagnosis is very high, because it presents like common malaria. It doesn't have specific. It is towards the middle, after some few days, you will now start seeing some specific symptom. That is what it is. That is why it is called viral hemorrhagic fever. Now, the patient will start having redness of the eyes. It can start bleeding from any orifice, from the mouth, from the nose, from anywhere. It can start passing blood in stool. It can start having bleeding on the skin.
And within that period, anybody who had come in contact with that individual, even before that, like a doctor,
yes,
who could contract
exactly. Anybody that comes in contact with the person could contract the virus.
Okay,
and even after, you see, there are some people that are fortunate that may survive. We have seen instances where some people survive the infection. Even after survival, it has been shown that the virus will still be there. So the person may still be infective some weeks after surviving the infection. So in fact, there was a case of a particular man that was infective 7 weeks after he has survived this infection. So the fact that the person has survived does not mean that it's not infective. So that is.
Let's just take a look at some statistics now. I'm going to come to you. We take a look at that statistics, and then I'm still waiting for that statistics. There you have them. Now, Liberia, Sierra Leone, and Guinea are the worst affected, and the death toll, we understand, is now 603. So 603 persons have died from the virus, and the virus has a 90% death rate. 90% death rate. So meaning, in 90% of the cases, those who contract this disease are likely to die. And symptoms start 2 days to 3 weeks after contracting the virus. Dr. Olubunmi, just how devastating would it be should this virus come into the country? Because whether we like it or not, I mean, our health institutions are not really, we still have challenges there. Especially when you talk about the rural areas. And rural areas, we're talking about areas where the crave for bushmeat is really high. Most of the people in these rural areas are hunters, and health facilities at that level are just not up to scratch.
Yes, thank you very much. We are going to be faced with a lot of challenge in containing this virus, especially in the rural areas. But the single most important thing is education of the public enlightenment, through radio, through television, through newspaper, through community workers, and so on. And because once you enlighten the people and they know the modes of transmission, then it's possible for people to now prevent, avoid contact in those areas. So public education is the most important. Unfortunately, we still have a lot of challenges in our healthcare facility when you are talking of preparedness to handle cases like this. You see, we are faced as our condition is so that we are never prepared for emergencies.
We're going to talk about that preparedness, and yes, we're also going to talk about your strike as well and how it's likely going to affect this. So we'll take a short break now. When we come back, we'll continue this discussion. Every day, every hour, and every minute, news break in Nigeria. Things happen so fast, it's most times difficult to track and comprehend them. But that's what we do right here on DEJI360. 2015, would you want to come back again?
It's like asking Jesus Christ, if he knew he was going to die, will you want to come back as the savior of the world again?
We do not just help you track the stories, we break them down, explore all the angles, analyze the issues so that you can fully comprehend the stories and use them to make the right decisions. Welcome back. As the doctor has explained, there are actually five Ebola viruses. Now, the one that is the most deadly of the five, as is explained, is called the Zaire Ebola virus and has killed 79% of the people it has infected. The virus is called Zaire, of course, as the doctor has explained, because it is named after Zaire, which is now the Democratic Republic of Congo. And Zaire, by the way, or DRC, by the way, along with Sudan, experienced the first Ebola outbreak back in 1976. Now, why is Ebola back? Because it comes and goes. Now, the viruses are constantly circulating in animals, most likely bats. Every once in a while, the disease spills over into humans, often when someone handles or eats undercooked or raw meat from a diseased ape, monkey, and several others. Now, issue is, an outbreak can then happen for several months and then it becomes quiet again. Ebola can completely disappear from humans for years at a time. For example, there were 0 recorded cases of Ebola in 2005 and between 2005 and 2006. Now, one of the main things that seems to make Ebola viruses especially deadly is that they can seem to be able to, they can actually evade much of the human immune system. Among other problems, white blood cells from the immune system are often seen, well, you could have problems with that. They just evade the immune system. So you don't see them in patients. And if the body can fight fully back, the virus can just keep taking over. Now, I still have Dr. Olubunmi with us here to discuss this further. Dr. Olubunmi, no doubt there's no cure for this. There's no vaccine. It's a very difficult situation, and then in Nigeria today we have an individual suspected to have the virus, and this is the time when we should be calling some kind of emergency in the health sector to put in place measures now to check if this is it, to put in place measures to check the spread, and you're on strike.
Okay. Well, thank you very much. Very vital question. The issue of our strike...
It could affect...
The issue of the strike action has nothing to do with because we have been on strike for almost 3 weeks now. But
yeah,
unfortunately,
of course. You're right. But
unfortunately, this has come up now, and a lot of effort is already going on to make sure that this disease is contained. Right from officials from the state and federal Ministry of Health.
Because even you too, you are the most at risk. Actually.
Exactly, because we are even at risk. And so all the means of protecting ourselves should also be available to us. So that because the people that are the highest risk are the doctors and the nurses and some other healthcare workers in the hospital that will come in direct contact with these patients. So I think the government should make sure that we have all these protective facilities, as has been said earlier, in all the hospitals, so that any suspected case, yes, any suspected case can be managed properly. The patient needs to be quarantined. You have to be treated in isolation.
Do you have facilities? Do most of our hospitals now have facilities to quarantine, individuals with suspected cases like that?
Sincerely speaking, I don't think most of our hospitals have the facilities. It's not good for us to deceive ourselves. So we need to really wake up, because if this disease enters some of the hospitals, it will be devastating. How
seriously should individuals now take the issue of fever, typhoid fever, and all of that? Because it's just so easy these days. People just say they have fever, and then they just run to a pharmacist and they just get a drug, anti-malaria drug, and they think that's it.
That is one of the biggest problems we have in Africa, Nigeria and Africa generally. You see, we have what we call malaria typhoid syndrome in Nigeria. Everybody has malaria and typhoid. Whenever you are sick, when you have fever, there are so many quacks running clinics and all those things in Nigeria. So those people need to be aware that the fact that you have fever doesn't mean it's malaria now. And anybody that has fever, you must actually, the suspicion must be there. And from your history, from the proper history, you will be able to know whether, okay, has this person visited an endemic region? What is the occupation of this patient? Is there any risk of actually contacting this Ebola? And from the history, so that is what will arouse your suspicion. But not all fever is malaria and typhoid. And that is what we should tell our people.
Is there a possibility that someone might have died of this virus without we knowing it in this country? That in some remote places where nobody knew, and nobody knew what was wrong with them?
It is very possible, very, very possible. In fact, I doubt if some people have not died without knowing, because how do we even track people? How do we have the system that monitor all these things? So a lot of people could have died in remote villages and some other places, even in the cities, without us knowing. So, but at least, thank God that in the private facility where this man went to, the doctors there were on alert, and they were able to identify it. So at least now that we know that the risk is with us, we will take all the necessary precautions that we are supposed to take to make sure that this thing does not spread, because it's a deadly disease. Just as you said, 9 out of 10 people infected will die. So it's a deadly disease which has to be contained. And anybody whenever there's any suspicion, report to the appropriate quarters, Ministry of Health, report to hospitals, and let the authority be aware, because it's a disease that has to be reported.
So what will be your final word, because we have to end the program now? What will be your final word? Okay, my final word to Nigerians and to everybody is that we should not panic. What we should do is to get the knowledge that we need to do, we need to have in order to contain the disease. For those of us who have access to internet, to radio, to TV, to all those things, we can utilize the information. The fact is, the government is not doing enough now in terms of enlightenment. Let's just be straight. Exactly. Yeah. The government needs to actually come out and bombard everybody with information concerning this through all the media that is available, so that people can have the knowledge of the disease and be able to prevent the getting infected with it. Dr. Olubimi, thank you very much for coming on the program. Thank you very much. And thank you very much for your time. Yeah, thank you. Well, that's it on the program. If you want to watch it again, it's simple. All you just need to do is go to our website, tv360nigeria.com. You'll find the program there and lots more. You can also watch us on YouTube by subscribing to our YouTube channel. It's youtube.com/TV360 Nigeria. Follow us on Google Plus at TV360 Nigeria, and you could like us on Facebook. The address is facebook.com/TV360 Nigeria. You can also follow us on Twitter. Our handle is at TV360 Online. Thank you very much for watching again. I am DEJI360. We'll see you next week.